Hello, everybody, and welcome back to Grand Rounds Atopic Dermatitis. I'm Douglas DiRuggiero. I'm a physician assistant that practices in Georgia, and I have the honor of being here with Dr. Lisa Swanson. I'm going to let her introduce herself. We have already completed one episode and enjoyed it immensely, and we're looking forward to a second episode with 2 more new cases.
The fun continues. Hello, everyone. I'm Lisa Swanson. I'm a dermatologist and pediatric dermatologist in Boise, Idaho. Thrilled to be here.
Why don't you start us off with your case first?
Perfect. Okay, so Douglas, this is a 6-month-old boy with a history of eczema since birth, significant involvement on the cheeks, very itchy, having trouble sleeping. If you see kids in your practice, you've all seen a kiddo that looks very much like this. The really stubborn, hard to treat atopic dermatitis on the cheeks and often the chin. Sometimes it's drool is a factor, but it's not the whole thing. We see it just really prominently there. And then often they have eczema elsewhere, but it's these cheeks that are so tough. And then of course he's 6 months old. So that's a tough age if you think about what's approved for a 6-month-old. So basically you've got topical corticosteroids, you've got crisaborole, and you've got dupilumab. Those are basically the 3 things approved in a 6-month-old. And so I discussed those options with the patient and their family, but I also discussed somewhat of a unique old treatment that I use a fair bit of, especially in these kids with the really stubborn cheek eczema, and it's something called the Aaron regimen. Douglas, have you heard about this at all?
I have, yes. I'm familiar with Dr. Aaron. We've lectured on this with Dr. Leo, who's a big fan of this also, Peter Leo in Chicago. So please tell our colleagues about it.
Yes, I actually heard about it from Dr. Peter Leo, and Dr. Aaron was a dermatologist in the UK. He came up with this compounded mixture called the Aaron regimen decades ago. And it's pretty simple. It contains betamethasone valerate, mupirocin, and then either Vanicream or Plastabase as its base. And I'll go ahead and rattle off the recipe if you guys want to grab a pen and paper. So 30 grams betamethasone valerate, 24 grams mupirocin, and then 400 grams Plastabase or Vanicream. And that makes a 1-pound tub. You can also have it compounded into a half-pound tub, which is actually typically what I do. And because of how dilute it is, it makes it very safe. It makes it very appealing even to the steroid phobic families, which is good. And it's safe enough that you can apply it up to 5 times a day for bad flare-ups and then taper with improvement. And it's safe enough you can use it every night at bedtime for prevention and maintenance. And I speak from experience. This is the first thing that I have found that adequately controls and maintains these little kids with the persistent cheek eczema. I have tried everything through my 14 years of practice, topical steroids, TCIs, crisaborole. Nothing touches it and maintains it over the long term like the Aaron regimen does. Now, one important caveat. Some people will prescribe the components and have people try to DIY it at home. It is not the same. When it is compounded, it doesn't work nearly as well. When it's compounded, they use a powder base of the mupirocin and the betamethasone valerate. I think it mixes much more evenly. And I think part of the reason for its magic, I think it's flora related. I think that little bit of mupirocin in combination with the anti-inflammatory benefits of the betamethasone valerate, I think it helps normalize the flora on the skin, and because it is by far the most effective thing I've seen for this type of eczema. Mm-hmm. Yeah. Have you had a chance to try it at all, Douglas?
Yes, I have. And I also have had the same experience that you have had with trying to tell patients to mix this on their own, writing for a tube of mupirocin and the tube of betamethasone and buying a tub of Vanicream and then mixing it at home. On the first episode, I talked about compounding a triamcinolone lotion into CeraVe. I have people do that at home. I have them sometimes mix clobetasol solution, 50 ml into CeraVe. I have them do that at home. But in this particular situation, as you've said, when a compounding pharmacy does it, they're using the powdered ingredients, and the compounding is much more potent in that scenario than if they try to do them all on their own. But I love this case because we all see these kids. Larry Eichenfeld calls these headlights. like these two red cheeks. It looks like the headlight sign that you have. And I don't know if this is the case for you, but parents, they just so badly want it to be an allergy to the detergent on the blanket that they rub their face against, or they're crawling and their face is hitting the carpet. They need to take the carpet out of the house, and it's just they so badly want it to be something else besides this disease, which and I'm not saying those things can't be helpful if it's an irritant component to it, if they're constantly rubbing. But for the most part, I think you and I know that we would love to say, if you did this and changed your house in this way, or forced them to, use this detergent, that detergent. Yes, there's wisdom in all of those practical things that we recommend. But in most cases, if they've got persistent cheek eczema, changing those things doesn't change their eczema very much. You're going to need to intervene.
And the one thing I've noticed, I'm not sure if I've seen it reported, but kids with this very prominent cheek eczema, I think they actually outgrow their eczema at a higher rate than kind of standard kiddos with eczema. So I frame it in a positive way that, like, yeah, we struggle with it these first few years of life, but then your kiddo has a good chance of outgrowing it. The other thing they constantly want to try to blame the eczema on is a food. And it's so hard because it's rarely a food. And, honestly, I tell a lot of families, I wish it was a food. Do you know how much easier my life would be if I could just tell families to, avoid egg and your child's eczema will go away? There's a part of me that wishes it was that easy, but unfortunately, it's a little bit more complicated than that.
Yeah, and we even have some parents that want to not only just be a food that they consume, but they feel like the food touching the face when they move into baby foods and they're getting food all over their face. Could the food actually be a contact and then an absorption, as opposed to consuming something and having more of a hypersensitivity reaction? And we just don't have good information that really shows that either one of those, unless they have a very reproducible, contact allergy that you can say, yes, every time this touches their skin, I can see it worsen. Well, okay, then maybe that's legitimate. But for the most part, it's not the case. So,
and as a side note, we now believe that it's the eczema that causes food allergy, that allows those particles to enter through the skin's broken barrier and trigger an abnormal immunologic response, which becomes allergy. And there was a study in our Peds Derm literature looking at kids with facial involvement of their atopic dermatitis versus no facial involvement. And the incidence of allergy in the facial involvement kids was much higher. And so we really want to treat this to make it better and actually help hopefully reduce the risk of food allergy in those patients.
Yeah, it'll be exciting if we get some of the non-steroidals down to a lower age too, because of the age indication of a 6-month-old, we just don't know how well the topical JAK inhibitor would help. I think it would help tremendously in these cases, or the topical PDEs and things like that, or some of the new ones that may be coming along. But all of those are going to be way too high in age category for us to consider in that one. So this is my case. This is a 41-year-old. White male, mild AD since childhood, right? But his hands are persistently scaly, itchy patches. This has been going on for 3 to 4 years. He's had no change in occupation, no change in hobbies been doing the same job for 15 years. This is tough, because we know that, so you can see the second, situation here, previous treatments. These are things you want to think about and ask. Would you consider patch testing? Is there previous treatments? What have you tried? What's not working? What do you do? What are your hobbies? What are your hands? And how much do you wash your hands? And so, I think that this case is interesting, because it's hand eczema is just such a difficult thing, because we can have an irritant component and it can have a true contact component. You can have a bacterial component. You can have a tinea manum that can hide on you, tinea incognita that can be involved, particularly if you see nail involvement. So you really, and just outright, you can have atopic dermatitis that involves the hands. And, we know that dupilumab has gotten a label inclusion for treatment of hand and foot eczema, with patients with atopic dermatitis, and has shown some good benefit to that. So, I come to this, I can tell you what I did with this patient, and I can see if you would have disagreed. He'd been on steroid creams almost his entire life, and already using steroid creams on his hands on a regular basis. These folks, they collect steroid creams from all different kind of providers. By the time you're 40 years old, you've been living with you've got a whole drawer full of tubes. that are years old in some cases. And he just wanted something different. I feel like I've already thinned my skin. Don't want more. I'm not sure I'm bad enough to want to go into a systemic, but tell me about them. So he was open to hear about it. But this is, to me, just a great clinical case for topical ruxolitinib. It's the age categories there, limited body surface area, twice-a-day application. And for this particular patient, I don't have a follow-up photo, just responded beautifully. I mean, pretty much I would say that the HEXI improvement, that's our term that we use for improvement with hand eczema. HEXI, hand eczema and severity index. If we were doing that type of rating on him, he would have a HEXI of 90 to 100, just after using topical ruxolitinib twice a day. Came back and saw me in 2 weeks. And he was just so happy. The itch was gone, the scaling had disappeared. So it was a real home run for that topical medicine in this particular patient, and kind of checked all the boxes for him. Now, we talked about in the last episode, how do you handle this presentation? Because you feel like you want to always let them know, hey, if you pull this up online, there's some things you're going to read about, and they may sound really dangerous. So I'd rather you hear these things from me and from someone else. And it's a little bit of a different presentation for me in the adult versus the mom of a 12-year-old, because you're addressing the fears of the mother versus addressing, the comorbid conditions of somebody that's like this, So I think you have to really, particularly, in both categories, you can't skip addressing it. You can't skip addressing the box warnings that will go with this whole class. And like you said before, I also like to tell them, I said, look, all these JAK inhibitors have these box warnings included in them, and it all stems back to a medication that was launched in 2012 for rheumatoid patients that had other comorbid and other health conditions going on. And you go through their medical history, and these are things that do not apply to you, and the systemic absorption of this is minimal. And so I think that you're going to read about those things, but I'm at ease and I sleep well writing this medication to my patients, and you should sleep well also. This is a case from about a year ago, and still comes in for occasional checks and doesn't want to change. I'm super, super happy. So
if it ain't broke, don't fix it.
Well, listen, this has been our second episode of our Grand Rounds with atopic dermatitis. It's been a lot of fun, and we look forward to you joining us for our next 2 episodes. So stay tuned.